My first interaction with the field of medicine was actually visiting my grandpa in India. We went to go visit him after a major cardiac surgery. Meeting the doctors that saved his life was very inspiring to me, and it made me really interested in learning a little bit more about what patients face in our healthcare system here in the US. And ultimately that motivated me to pursue a career in medicine.
When you look back at your time at UT Southwestern, what was your main kind of area of focus?
I'm the first person in my family to go to medical school, which has been really eye-opening. I think most of what I tried to focus on was learning more about patient experiences, kind of like my grandpa kind of inspired me to do. I did that in a number of different ways, especially through my service. I wanted to learn about what barriers to care folks who are unhoused were facing in the North Texas communities. So I was one of the executive members for the Patient Navigator program, which works with folks who are either underhoused or unhoused in the Dallas community. Kind of personal to me as well, because there are not necessarily members of my family in India, but folks that we know abroad that also kind of experience some of those similar problems, and I've seen firsthand how that can affect their ability to access care. We were even able to start a program to help them get Parkland financial assistance, was really important. It was a wonderful experience, and I'm glad to see that it's still going strong today.
When has there been an opportunity for leadership for you, and kind of how did you respond to it?
One of the earliest opportunities in medical school was I, on a whim, applied to be a test committee member for our student government, going through all the different quizzes and tests that we take that first year and a half of medical school, and hearing out the students if they had any concerns about some of the questions and trying to see if we could make it the most fair assessment possible.
Can you kind of touch on a little bit more on what you were able to research and get involved with there?
I had the privilege to work with Dr. Sarah Lieber in the liver department, and she focuses a lot of her work on learning about liver transplant recipients and some of the barriers that they face in receiving their care, as well as some of the socioeconomic barriers that prevent them even receiving the care that they need in the first place. And just being able to learn about what the different components of that care look like, and how even after receiving life-saving treatment, there is so much work to be done, has been very illuminating. And just, I am so thankful to be able to learn from such an amazing mentor. So it's been an amazing experience.
Looking back on your medical school journey, what is something that surprised you, whether it was about yourself, about medicine in general?
One thing I wasn't necessarily expecting was just the impact that a medical student can have on patient care. Just seeing a patient on rounds and just asking how their night went, or having a very serious conversation in very critical moments with patients and their families, and having them look to you to see what you think about such a crucial moment or a very critical situation has been very grounding. You know, healthcare is a scary thing to navigate, and just knowing that I may have the tools to be able to help people navigate that, I think, is what really energizes me.